At a flip of a coin, if I ask you to decide whether you want to go for surgery or to go into business, which would you choose?
Welcome to Human Elements, where we explore stories of leaders shaping the industries. Our guest is a visionary, a true leader who inspires professionals and entrepreneurs across generations. He is a prominent figure, and his contributions have played a vital role in reshaping Qatar's private healthcare sector. Let's get inspired by his stories and insight. Welcome, Doctor.
Thank you.
Doctor, let's start with something that I'm very curious about. I hope you remember when we met for the first time, where you were a guest and I was a moderator.
Yes.
At the same event, one of your employees told me that if you ever work with Dr. Sameer, you will not want to work with any other leaders.
Okay.
So I believe there's something truly amazing about your leadership style. What is that?
Well, thank you, Chinju. It is actually, it's an honor actually to hear something like that. But yes, see, basically, I'm a people's person. I like to be among people, knowing people, and I would like to, to any extent, whatever extent I can, be of any sort of help. I would like to do that to the people around me.
That's amazing.
So I don't see this as a employer employee sort of, or a manager subordinate sort of this thing. It's like a family. I value each and every one in the organization, and whenever they have any issues, I would like them to come and talk to me. In whatever way I can support, I will support them. So you said one of my staff
Yes.
chose the career
Career.
because of me, because she wanted to take finance.
Yes.
And I said, no, finance is not the right thing for you. You should take HR. So, because I've seen them
And she
working.
believes that that was the right choice she made,
Yes,
and it was because of
definitely.
your inspiration.
Definitely, yes. Because the thing is, um, I couldn't see her. She didn't have a accounting background.
Accounting background, yes.
And she's good to deal with people. So that was the right career for her.
That's a right career for. So that is your secret to keep people so close to you.
Well, see, greet everyone with a smile.
Absolutely.
Know them well before you start interacting with them, like giving them orders. Rather than giving them orders, try to discuss with them.
Yes.
So this is what it's an interaction mostly.
Yeah.
In any organization.
It's
It has to be communication. Communication has to be the most important thing.
important key to it.
And you need to know everyone will have their own issues. So we need to understand those issues and then deal with them. Well, this is something which my dad taught me.
Yes.
Dignity of
Okay.
labor. He used to
Dignity of
tell me dignity of labor. He was very clear. Like, he treats each and every one the same way, whether it is a cleaning boy or a manager or whatever it is. Everyone is treated the same way.
The same respect for everyone. I think
Same
that's the
respect for
same that
everyone.
you're following.
We see people as individuals, not by the position or by any number.
That's something all of us can practice in our everyday life. That we see everybody as individuals, as they are, as human beings. A very few people have this amazing combination of titles like yours, doctor and entrepreneur. Generally, doctors move to their clinical practice right after their education, but you chose a different path. What was your inspiration?
Well, I come from a trading business family. Both my from my paternal side and from my maternal side,
Okay.
both my grandparents were business people,
Business.
and my father is also a businessman and into trading and all those things. So that has been there right from a very young age. Like, even while studying, the he had given me a total amount of the fee, and I tried to do business with that.
That's
So
interesting.
this has been there right from the beginning.
Okay.
So Uh, so one thing is, but then of course, I
But that,
by initially I wanted to be an engineer,
okay,
then decided against that, and then went for medicine.
you went for the medicine.
And then by the time I finished my medicine, I had in my first year of MBBS, I had a slight delay because of some issues there. So that delay actually made me think again and again about what my path is. So I was very much interested in surgery, and I was good in it also.
Okay.
I wanted to be a surgeon.
All right.
Really wanted to be a surgeon, but
Okay.
then the time taken for a surgeon to start on his own is the incubation period is too long. Like for example, you need to do your postgraduate degree, then
Yes.
you have to go for super specialization.
True.
You work under a super specialist for 4 to 5 years or 6 years, and then you start your career.
Yes.
So that was the deterrent for me for not going for surgery.
Surgery.
And I also did like nowadays, uh, I went to a counselor
Okay.
after I finished my MBBS. I had these two things in mind: either to go for surgery or to go for go into business or into the projects and things like that. And I went and met a very famous career counselor called Ali Khwaja
Okay.
in Bangalore,
Right.
and he gave me a test, a psycho therapy, like a sort of a psychometric analysis he
Okay.
did, and then he asked me to come the next day, and he kept the result upside down. He didn't show me the result, he kept it there. And then he said, at a flip of a coin, if I
Okay.
ask you to decide whether you want to go for surgery or to go into business,
Business.
which would you choose?
Okay.
I said business.
Business. Okay.
Okay. Because that negative things were going in my mind. It was a 350 question, it was a 350 question questionnaire
Okay.
that I had to
That you
fill in
had
the
to fill.
previous day. And then he said, okay, that's the choice that you made. Here is the result for you. He
And
had written on top of that that you should not go for surgery, you should do this. Surgery was my passion,
passion.
but this is
There's a
this is what
business.
you are meant for.
Yeah. It
So
sounds like business is your innate ability.
maybe the ability to see through things or to visualize things in a bigger way.
Yes.
So that was like, even if it is construction or whatever it is, I was very much interested in that part.
Yeah.
Like you give me, there are no project managers here for any of the projects that I've done. The site was handled by me. Being a
Okay.
doctor, I handle the site
Yes.
because that I
That
have an interest towards that, and I have an interest towards visualizing things and then making it happen.
making it happen.
So so that is the reason why even after coming here, I didn't go into practice.
You didn't go into practice
Yeah,
and
I didn't
you
want
chose.
to. First and foremost, I didn't get time to practice. Like
Okay.
initially, when I came to set up the organization that I worked for, there was I was the only one.
Yes.
I was the only one in the management, like administration.
You were the only one in the
I never.
administration.
I just had an accountant.
Okay.
I just had an accountant, a driver, and a cleaning boy. We started the clinic, and only after I think of 3 years or so, we had the other administrative staff
Staffs.
coming in and joining.
Okay.
So so the load of that was actually, that's the reason why
But
I
that
didn't
really shows
pursue.
your skill.
Yeah,
Like,
no, I
because
didn't pursue the. No, right from A to Z, I had to do it on my own.
yes.
I always tell them the first person I interviewed here was an office boy, and I was sitting in that site office, and I had to dust his chair before he could sit there because it was full of dust.
Yes, but
He was
how
the
does
first
that make
person.
you feel? Like when you think about that journey,
Yeah.
moving from that point where you are today, how does that make you feel, that transition? And it's not a simple journey, I'm sure about.
It's not a it was a tough journey.
Yes.
Definitely, it was a tough journey.
So compared to the challenges that you have faced in your past, whatever you face today is nothing compared to that, I believe.
No, even today we have surprises and challenges.
Yeah, but that never makes you feel weak.
No, because we know that these challenges will
Yeah,
come, and
absolutely.
if you really push forward, you can overcome that. You
Exactly.
need to be
So
focused,
those
and you can
challenges
do
can
that.
never challenge you.
Well, I like challenges.
You like challenges.
I like challenges.
Yes, this story reminds me of that you were part of the leadership role of another organization
Yeah,
for more than 2 decades,
yeah, true.
and now you have started a new journey. And how does that journey look like from the beginning? So you already have an experience of starting something new and building it really big.
True.
And again, you're starting from the beginning.
Yeah.
And I'm sure you have a lot of power within yourself, that power in terms of experience, the power in terms of the people that you have, and the power in terms of the skill that you have. But still, I'm sure the new journey is always a new journey.
Well, I would rather say I'm reliving what I did.
That's an amazing perspective.
Yes, I'm reliving what I did when I came here in 2002.
Yeah.
It's actually reliving the whole thing. I have the same contractor. I have the same, it's almost the same
Same.
location. So I'm actually reliving that
Reliving.
whole journey that I came through. And uh, and now I have like this is like a family.
Yeah.
See, when I in my previous organization, up to when I had almost around 400 employees or 500 employees, I knew each and every employee by
Yeah.
name, by their I knew their families, and I knew what individually I knew each and every person. But then I lost that connect, because of the work pressure and
Yes.
things like that. As I said, I'm not a numbers person, I'm a people's
I
person.
remember that now.
Yeah. So, and what made this new journey so far very successful is the team that I have. Now, I have people whose majority of the team that are around me today are people, all of them are more have been working with me for more than 10 years.
That's why I told you.
10 to 18 years.
Yeah.
They've been with me as a team for the last,
Yes.
most of them more than 13, 14
13,
years.
14
And
years.
the rest, like there is my CEO has been with me for the last 18 years.
18 years. So that was my first question. So the
Yeah.
something that's making people stay close to you. So that's there in your leadership skill. Your new journey, Wellkins.
Yes.
Why the name Wellkins?
Yeah, Wellkins, it took almost 2.5 months, and we had shortlisted almost around 80, 83 names, and then we had brainstormed and come to this name. So
Yeah.
that is Wellkins. So Wellkins is well and kins. So wellness for your kins, so your friends and family. So that's how this name is coined.
Yes.
So it's not just a name, Wellkins. We have thought behind that.
Thought behind that. Yes, that's clearly evident. A lot of thoughts gone into the process of choosing the name. And I'm sure your agency or the branding agency might have helped to add a lot of value into it.
So we don't have a branding agency,
You don't have one.
and we don't have and no agency was involved in choosing the names.
Choosing, okay.
So as I said,
Yeah.
2.5 months of brainstorming. See, what we did is we started off with the parent company, which is
Okay.
DSM
Yes, DSM
Healthcare.
Healthcare.
That is Dr. Samir Moopan Healthcare.
Yes.
I didn't want to put that name, but my partners, the three friends that I said,
Yes.
they insisted on this name. So I said, okay, fine. Since I've been in this market,
For a
in
very long
this country for almost 20, 24 years. So I thought, yeah, we can leverage that. So DSM Healthcare was formed. Then we sat down, the team sat down. We wanted a name for the clinic, and that's where I said we we had 160 or 190 names. From that, we shortlisted 83 names.
Okay.
And this 83 names was deliberated among the team. Like all these days, what we were doing is we were picking and choosing, looking at the pros and cons. Then finally we came to this Wellkins.
Wilkins.
So that had the essence of what we wanted, what we
Yes.
actually wanted to have in a name.
Yeah.
Wellness,
I,
what we
for,
stand for our friends and family.
amazing. Yes. And I'm sure then there are a lot of thought behind the logo also.
Uh, Logo, yes. We discussed, I think, almost around 10 or 15 logos. So we wanted something which is close to our heart,
Okay.
and our team was able to. It's all in-house.
Okay.
Whatever I'm telling about is all
That's why I
in-house.
specifically asked about the logo when you
No,
mentioned
because even
you do
the
not
logo
have a
was
branding
done
agency.
in-house. So we wanted something which is close to the heart, looks like a heart, but at the same time, my team surprised me with my initials on that, DSM, inside that. The logo has
Yes.
DSM in it.
Such precise details.
Yes.
That's amazing. Having said that, now after 2 years of full-fledged operations,
Yeah.
where have you placed Welkins at people's mind, like your customers and your patients' minds?
Well, if you ask me, Welkins is not. Uh, Welkins is a not a premium brand. Neither is it a cheap brand.
Okay.
Okay. So what we are focusing is on people's wellness and the service and quality.
Okay.
Now this is exactly where we want to. We have a clear idea on how to go ahead with the thing. Even selecting the doctors, for example,
Okay.
it was a process. Like we wanted everyone to gel into the idea or the ideology of Welkins.
Yes.
We have the vision, we have the like we have the vision and the values. So we wanted everyone to gel into the values and
Values.
the vision of Welkins. So this
Welkins.
is exactly why the like if you look at we have not we had a lot of applicants who
You
have
had a
come
lot.
in, doctors and all the, we have
All the
not
others.
taken most of them.
Okay.
We went one step ahead in by choosing people who will gel into the team and who will reflect the vision and the values of Welkins.
So all the
So
peoples I see at Welkins are handpicked.
handpicked, very much handpicked, I would say, because like that's not how we used to earlier do it, but now we are very
Keen on
particular
that.
about picking people uh,
Yes.
in the organization. Now, so what we tell the people is to experience the difference.
Experience difference.
So that is what is making us special.
Okay.
We are not concentrating on the price.
You're
We
not.
are not a cheap. We are not, neither cheap nor too expensive. We are affordable.
You're
We want
affordable.
to keep it affordable for people.
But how do you see that from a business perspective?
Well, see, you don't have to overcharge a customer to make profits.
All right.
See, that's not
Something
the.
different I'm hearing, so I'm
Yeah,
eager to
because
listen to that.
we do charge what is nominal for
Okay.
the for that particular service, a nominal charge, a
Yes.
decent nominal charge is what we charge. But where we have made the difference is actually in the process.
What do you mean by
Now,
the processes?
like, see, we have our own software,
You have
which
your
we
own.
developed our own software.
Okay.
And we reduced like the manpower, for example, where we need 10 people. Like,
Yes.
say, for example, for approvals, insurance approval, and all those things. The actual work, you actually need around 10 people to do the work that is present what we are doing, which one person is doing it,
Okay.
because we have integrated that process in our software.
Yes.
So we made the process is so streamlined that we
Yeah.
don't need more people to handle it.
Handle it.
And we have the AI based, the like even for appointments, and the call center is
Okay.
handled by one person.
Okay. Yes.
We don't want people to call here. They just have to go to our website, and everything is,
Yes.
they can get it. Uh, Even taking an appointment will only take around
Yes.
30 seconds. Why you need to call and ask and do all those things? You don't have to do that.
Yes.
In 30 seconds, you can take it.
Yes. So the operational decisions that you have taken balance it all.
No, that's what the operational cost is. We have reduced the operational cost
You have reduced.
to a large extent.
Yes.
As I said,
So
instead
that's
of
how
10
you
people,
can.
if you can do it with one person,
Yes.
just imagine the cost that is being saved.
Yes. So that's how you can provide quality service at an
Exactly.
affordable cost.
Exactly.
Amazing.
So what we are doing is we are trying to reduce the people in the back end operations and provide more people in the front end to handle the
Yes,
customers.
customers.
So the customers are also happy.
Yes.
They're taken
Now I
care of
know
well.
where you have placed Wellkins at people's mind.
Yes. And one more thing is that recently, for this process that I have been mentioning, the
Okay.
business transformation.
Transformation.
So we got the award from the Ministry of Communication and IT
Excellent.
for the best digital business transformation.
Wow.
So this award we recently received it,
Yes.
and there were a lot of contestants. We had tough competition from others,
Yeah.
but just in 2 years we were able to get this.
Doctor, this reminds me of your e-waste campaign, an innovative approach, I must say. What is it about and how is it connected to healthcare?
Okay, the e-waste campaign was actually part of our CSR activity.
Okay.
So and so we thought that helping people to remove their uh, it's a huge issue. Like, you have n number of
True.
electronic waste in your house.
Yes.
It is compiled. So
We do
you
not know
you
what to do with it.
yeah, you don't. Nobody knows what to do with that. So
Yes.
we partnered with a company, Seashore, and then started off this campaign. So, and in the last year's CSR Summit, Qatar CSR Summit, we won the award for our campaign. And in the healthcare category, we won the award for our campaign called "Turn Your E-Waste to Wellness."
But doctor, how can general population benefit from this campaign?
Okay, so what we have done here is that we have given certain points.
Okay.
We give points for the e-waste that is being collected. So
Okay.
per kg, we have fixed certain points, and that is actually worth a particular amount. So this
Okay.
will be kept as wellness points with the clinic. So if you have 10 kilos, like for
Okay.
example, we'll give a particular point
Certain number of
for a certain
points.
number of points, and these are kept as wellness points, and then you can actually redeem
Redeem
it
it.
for any of your treatment here, or you can use it for your checkups and things like that.
Okay. Yes, so that's basically beneficial for a lot of people here because
Yes,
a lot of us have a lot of gadgets lying around home and we do not know what to do with. And
true,
I must say this is very innovative approach and very useful approach for the whole society.
true. In the last 1 year, we actually started this campaign. We wanted it to. We were looking at 3 months. So in 3 to 4 months, we collected almost 50,000 kilos.
Um,
Now we have almost collected 100,000 kilos. apart from that, we also have one more thing. Like, for example, you spend any amount of money that you spend for your health, for your
Okay.
wellness.
Okay.
Like, for example, you join a gym, or you buy a sport shoe, or you go get some supplements, health supplements, or something like that, or your eyeglasses, or
Okay.
whatever it is. You can redeem your. You can send us the receipt for that, invoice for that, and then we will give you wellness points for that,
Okay.
irrespective of where you spend it, irrespective of where you, like, for example, you joined a gym
I
in
mean,
Qatar, you have to in Qatar, what we're talking about. So if you join a gym, actually you are you
I'm
don't
investing on my
you're
wellness.
investing on your health.
Health. Yeah.
So whatever you invest on your health, you would send us the receipt, and we will give you points for that.
This is a news to me.
Yes.
Because
So
this can be beneficial for a lot of people. Every day,
exactly.
every one of us spend a lot of money on daily basis on different things.
Yeah.
Like you said, like the running shoes or the gym or health and wellness products that we buy.
True.
A different thing. And I never knew that people can actually make use of these kind of spendings for their health. And at a healthcare center, that's a
True,
difference. I mean,
true.
this
No,
has a direct impact
we
on health,
want to
but
promote that. We want to promote that kind of, like, we want to promote people going to gym.
okay.
We want them to be healthy.
Doctor, I've observed that in our discussions, you always emphasize on wellness.
Yes,
And that clearly reflects at Wellkins too.
true.
Is there any particular reason for that?
Well, uh, we all have heard that prevention is better than cure,
Yes.
right?
Yes.
So that is something which, right from, like, when we started like, uh, any person who uh, is into the medical field, that is something which we have always been uh, taught
Yes.
and asked to follow. So especially, like, this became more evident during the pandemic, the
The
COVID.
band. Yes.
So people who were having other conditions were getting critically ill,
Yes.
and we lost a lot of them, a lot of
Yes.
people in those, like, who are not physically fit and things like that.
Got it.
So your well-being is very important,
True.
right? So COVID actually taught us a lot on
Yes. To
that.
prioritize
Yeah,
our
true.
wellness.
Yes. So this is one of the reasons why we also thought that we should focus on wellness rather than, okay, you have any illness, we will treat you.
Exactly.
It's not that we will not treat you, but our focus mainly is on your on wellness,
The preventive
like
measure.
preventive health, and doing checkups and things like that. To encourage preventive health, like, for to encourage the
The wellness.
keeping people fit and thing, what we have actually done is that we have started something called the wellness passport.
Wellness passport.
Yes. So
Okay.
wellness passport, in the sense, we keep monitoring on a daily basis. There are goals set for each person. So, for example, I am 10 kilos overweight. So I'll fix a goal for myself. Like,
Yes.
it will be in the next 6 months, I have to reduce 5 kilos, or in the next 3 months, I have to reduce 3 kilos. So,
Yes.
like that, goals are set, and then I'll start going towards that goal. So whatever I do towards achieving that goal, it has to be recorded on a daily basis. We
Daily
do that,
basis.
and it is
It
monitored
is
here
monitored.
by a doctor here, and then we give them advices on a daily basis, and we keep monitoring that. So
Yes.
once they achieve their target, whatever is that, they get rewards for that too, and which they can use for any of the, say, for example, you want to do a cosmetic procedure, you can use
You
this
can use
reward
for
points
that.
for that.
And this also helps us to be consistent with our wellness goals or
True,
our many of the people like they join gym and they're not very consistent with it, or many
true.
of us start some kind of wellness journey we try to start with. Before we wrap up, one final question. What are your aspirations for Wellkins and its people? When I ask its people, both employees and the patient population.
Well, I earlier said we are looking for, like, we are for the well-being of people, the wellness, the mental, physical, and all. Like, it's a like a holistic wellness is what we are looking at. So we want to have a wellness community.
Wellness community.
So rather, Welkins Wellness Community.
Wellkins Wellness
Wellness
Community.
community. Want everyone to be healthy, and we want to support that.
All the very best to that.
Thank you.
Thank you so much for your time, Dr. Samir Moopan.
Thank you. Thank you, Chinju. Thank you so much.